Hello, welcome to another episode of The Health Your Life. To all the viewers out there that are consistently supporting us, we're very grateful. Today we're going to be talking about something else apart from COVID, which we've been talking about for the last 3 weeks. Today we're going to be talking about the prostate and how it affects the health of men. Stay tuned. Okay, so the prostate gland. Well, in our discussion today, we're going to look at the function of the prostate and what symptoms one is likely to have when this prostate starts to enlarge, and also when you should go to the hospital and what will be done. In the videos to come, we're going to talk about the complications that may arise due to the prostate enlarging, and mostly these are going to manifest in patients or in men that don't seek medical attention. Okay, so let's jump right into it. What is the prostate gland? Well, the prostate is an organ that sits just below the bladder. Okay, you know that urine is stored in the bladder, and you know that the urine is drained from the bladder through the penis, through a structure called the urethra. Yes, so the prostate is just below the bladder and it grows around this urethra. So the implication is that when the prostate starts to enlarge, it squeezes the urethra and may significantly obstruct the flow of urine. Okay, but before we get into all that, we want to understand, why is this prostate important? Well, the prostate has nutritional function to the sperm. The sperm that is produced by a man that swims in semen has to be fed, and some of these nutrients are produced in the prostate. The prostate also contributes to the functionality of the semen itself and the viability of it. So having said that, we can acknowledge that the prostate is a very vital organ as much as male reproductive functionality is concerned. So we've mentioned that it may enlarge around the urethra and may cause obstructive symptoms. So how will someone present? What symptoms are you likely to have when this prostate begins to enlarge and it squeezes your urethra? Well, most men are going to present with complaints of what we call nocturia. So nocturia simply means passing excessive amounts of urine during the night, or rather more accurately, passing urine frequently during the night. Nocturia from the word nocturnal. So you have men that are waking up more than 3 times during the night to pass urine. Have you noticed that most people before they go to bed they pass urine? Then the only other time they need to pass urine is in the morning? Well, people that have nocturia, in the case of prostate enlargement, may pass urine maybe 4 to 5 times during the night. So they wake up 4 to 5 times in the night just to go and pass urine. They may also have what we call frequency. Frequency is, well, essentially it's also increased frequency of passing urine, but this is usually during the day and not during the night. Most of them are going to have a feeling as though, even though they pass urine, they still have urine remaining inside their bladder. So that's a sensation that they're going to have. So they don't have that feeling of completely emptying their bladder. Another symptom that they're going to have is a poor stream of urine. So as they try to pass urine, they notice that the flow of urine is very poor. And to add to that, most of them have to strain or to add a lot of force using the muscles of their abdomen to push this urine out of the bladder, which can be very frustrating and uncomfortable. Others may also have what we call agency. So agency is when, as a man, you cannot stop yourself from passing urine. So what happens to these men is that when they have this symptom called agency, when urine comes, they have to urinate there and then. They cannot wait, they have to do it there and then. If they do, it may leak and it may wet their trousers. And that's not something that you do want. And that's not something that you especially want to happen to you if you're traveling on a public vehicle and you have to go. It means you have to go. Other symptoms that these men may also present with include what we call dribbling. So after they finish passing urine, which may be difficult itself, they also dribble. So at the end of it all, they have dribbling urine coming out. It doesn't stop just there and then. No, it dribbles. So those are just some of the symptoms that men with an enlarged prostate can present with. When do you know that you have to go to the hospital? Well, if you are having any of the symptoms that I have mentioned, it will be prudent for you to go to the hospital so that a medical practitioner can assess you. When you're having prostate problems and you go to the hospital, the first thing the doctor is going to request to do is what we call a digital rectal examination. In short, he's going to put his finger in your rectum. Why? Because the prostate just lies in front of the rectum. So when the doctor puts his finger in the rectum, he's going to be able to assess the consistency of the prostate and also the size of it. And that will help him to determine if it's enlarged or not. He may further ask you to do a scan of the prostate just to get the actual dimensions. Then he may also request you to do what we call a PSA, the prostate specific antigen. Now what is this? Well, this is essentially a compound in the body that increases in amount when someone is having prostate problems with the prostate. So if you have your prostate enlarging, if you have prostate cancer, or if you have infection of the prostate, this PSA is going to enlarge. It's non-specific, meaning it doesn't necessarily say you have prostate enlargement or prostate cancer or infection in the prostate, but rather it's a suggestive test that when added together with other things the doctor is going to look at may help him to reach the conclusion of saying that you have an enlarged prostate or prostate cancer. For us to definitively know that this is prostate enlargement and not just prostate cancer, a biopsy may have to be done. And a biopsy is that the doctor is going to get a small piece of your prostate, and they will have it examined under a microscope, and that will tell us clear-cut whether it's just BPH, which is benign prostate hyperplasia, meaning your prostate is just enlarged and there's no cancer, or you may be having a cancer. So there have been certain things that have been attributed to people having an increased chance of developing prostate enlargement, and these include their lifestyle. So people that are obese have been associated to have more chances of developing BPH. People that are diabetic as well have been associated to have more chances of having an enlarged prostate. Certain diets have also been associated with having an increased chance, or rather having a decreased chance of having a prostate enlarged. And these include a diet that is rich in vegetables. These include tomatoes on top of the list, spinach, cucumbers, and many other greens. All these contribute to you having less chances of having an enlarged prostate. Okay, it's very good that you found this video beneficial, and please do share it with others. In the next video we're going to post, we're going to look at the complications that may come about due to the prostate gland enlarging. From your healthier life, have a wonderful day. And please remember to subscribe to our channel if you haven't already done so for more videos that we're going to post. Have a lovely day.